This podcast is intended for veterinary professionals. Whilst members of the public are welcome to listen, please note that the discussions are designed with a clinical audience in mind and may include technical or treatment-related content. If you are a pet owner with questions or concerns, we always recommend speaking directly with your own veterinary surgeon who knows your animal best.
Hello and welcome to the Nupsala podcast. Today we have the pleasure of Dr. Lauren Davis. Lauren is a qualified veterinary surgeon and the owner of Vet Relief Limited. So today we're going to be exploring the fantastic and fascinating topic of sleep in dogs. So before we get stuck in, Lauren, I heard the journey from being a vet to where you are now with Vet Relief is quite an interesting story. So can you start to tell us a little bit about that, please?
Oh, absolutely. Well, thank you for having me on, for starters. I really appreciate it. Any chance to chat sleep, I would always jump at. So yes, as you just mentioned there, so I'm a vet by trade. So never thought I would end up in owning a company that made dog beds. So it's been quite a leap. But that I've always been a bit of an in and out, baby in a maternity leave, and then came back into a technical veterinary role. And then I left veterinary completely and went into being a commercial director of a human healthcare mattress firm, which was a total, it's a family company. It's something that I was really passionate about doing. And I'd had some disillusionment with the veterinary industry at that time. I think a lot of us have been through that bump and grind. Yeah. Is it the profession or is it me? Turns out it was me. But really enjoyed being commercial director. Learned a hell of a lot about sales, about the way you would structure a profit and loss balance sheet, about operational things. Fantastic, loads of skills that we don't learn in the veterinary space. But my last return to the veterinary profession was 2.5 years ago now when I set up this company. And the reason that happened was somebody said to me, so I was introduced at a networking event, what do you do? So I said, well, I'm a vet, but now I make human healthcare mattresses. And it just goes to show, I think, how deeply ingrained that vet identity is. I thought, well, if I'm a vet, then I'm going to have to go back, aren't I? So no one in the world knows as much about mattresses and dogs as I do. I think I can probably say that with a straight face. It's a very niche skill set. So with that in mind, I set up Vet Relief to create orthopedic pet beds from a veterinary perspective. So kennel mattresses for clinics and our Ortholux pet beds for homes. I'm really proud of it.
Well, congratulations on that. And the business seems to be doing really well so far, doesn't it? You've had a really exciting couple of years getting that off the ground.
100%. It's been a huge learning curve. Plenty of mistakes along the way. I think any small business founder who tells you they didn't make any mistakes is lying, or they just haven't uncovered them yet. But we are growing really well. We've had a lot of support from the veterinary industry, which is fab. I think, and of course, to be honest, I was expecting it. It's a lovely profession, isn't it? We have vets and vet nurses and our paraprofessional colleagues, our physios, our hydros. We all really muck in and support each other, don't we? And it's been really lovely to experience that firsthand.
Yeah, absolutely. I'm sure it must have been. So it sounds, you are really passionate about this topic, mattresses and dogs.
Someone's got to be
specialist in mattresses and dogs. So why is sleep so important for dogs? Why did you go into this?
For starters, one of the main reasons that I took this on, not just because it was bizarrely become my field of expertise, was because no one else was talking about it. And that's not to say there weren't lone wolves out there who were banging the drum about sleep, and there absolutely have been. But no one who's created a platform to really be able to be heard. Is people trying to do that alongside very demanding day jobs, and it's really difficult to have a loud voice in that space. So there wasn't anybody really screaming about this from the rooftops and saying that this is important and we need to be considering it. And when you've got something that literally impacts every single patient that walks through your door, I think it's kind of crazy that we weren't talking about it. There's no patient that won't feel better for a good night's sleep. And that's why sleep's so fantastic, isn't it? And we all know that in our kind of, we talk about people saying, oh, I'm feeling a bit run down, you know, and to sleep, a good night's sleep, I'll feel way better, you know, or I'm a bit achy and stiff, oh, I slept really badly. Yeah. And all of those things directly translate to pet health as well.
That's really interesting, isn't it? So what are the impacts on health that we might notice in our patients or our own pet dogs, for example?
So for sure, so just like us, the two main sort of categories I would put impact in are behaviour. So just like us, your behaviour, you get shorter temper, you don't remember things as well, you know, you're just a little bit muddled, a little bit foggy, you don't want to get up and go, right? That behaviour aspect is absolutely the same. And then we have a pain aspect as well. So things ache a little bit more, you're more pain sensitive, you don't therefore sleep as well. And of course, we can end up quite quickly in a vicious cycle there where you're not sleeping because it hurts, because you're not sleeping, it hurts more. So I think those two aspects of pain and behaviour are really fundamental to why sleep is so important.
Yeah, that sounds really interesting. Is there any research or any kind of human research that crosses over that we've been able to extrapolate from?
Absolutely. So there's absolutely boatloads of human research and a lot more scant in the veterinary field. It's kind of touched on before. It's something that we haven't really spoken about much as a profession. But what's really interesting is that when we have got sleep research in pets, and there's some that is specifically for pet care and some where it's laboratory animals that have been used as kind of markers of human sleep. You could take the human trials right back. What we see is that there is almost perfect correlation in terms of brain activity and outputs from impact on dog sleep as there is people sleep. Now, they don't sleep directly the same as us. We have different sleep patterns and things like that. But in terms of the outputs of poor sleep, we can assume in a lot of cases that it is the same as what we see in our human research. And my question would be, why wouldn't we? It's something, you know, why wouldn't we? While we haven't got that evidence specifically in the veterinary field, why wouldn't we assume that those impacts are the same?
Yeah. So what are the differences then so obviously you've got a history in the human mattress field. What are the differences that you've brought over to the dog side? How do they differ?
Yeah, so amount of sleep required is the really big one that catches people out. So our kind of wild canids are quite often what we call crepuscular, so up at dawn and dusk, or nocturnal, mainly active at night. But we've sort of dragged our domesticated dogs into what we have, which is a monophasic sleep pattern. We go to sleep overnight, for a block of sleep, and then we're up all day. So we're kind of expecting that our domestic dogs will do the same, but actually they're not wired like that. They need somewhere around 14 hours of sleep. And I do a bit of a when I say 14 hours, because just like us, you have people who sleep way longer and people who seem to survive on 5 hours. So it's always an individual range, but it is on average way more by several hours than a human would require. So what we find is that people say, okay, well, the dog goes to sleep. We know it's 9 o'clock because, you know, she gets in her crate or she takes herself up to bed. And then they're kind of up at 6, 7 o'clock with us for work. But for a dog, that isn't enough. So they have a polyphasic sleep pattern, which means they do tend to sleep overnight at the same time we do, but they also need to sleep during the day. They have to have naps in the day to make up that time to get there, approximately 14 hours of sleep. And a lot of owners, and in fact a lot of pet professionals, don't realize that the sleep that their dogs are having in the day isn't just out of boredom or they're not just chilling. It's actually a real physiological requirement, and if they're not getting it, they will be in a sleep deficit.
That's really interesting, and I can see that, you know, in my own dogs, 8:30 is bedtime and we have to declare it, and there's biscuits, you know.
I mean, I wish people gave me biscuits at bedtime.
Yeah, it'd be great. So what are the things that can interrupt a dog's sleep for pet dogs at home?
So the nice thing about sleep is a lot of the changes that we can make to improve it are quite simple, quite intuitive, and quite often free. Because the things that impact sleep are generally the environment that pet is sleeping in, and then of course the impact of things like pain. If you've got stiff, you know yourself, if you've got a stiff joint, sore neck or whatever, then that can wake you. But if we're talking about healthy animals, then it's really the environment that bed is in and the bed quality itself. So are we talking, is there a lot of noise? Have we got a lot of light? You know, are we getting the lights off during sleep time and on during waking periods? What about the temperature? So as you know, you get the couples, don't you, where one's throwing off the quilt and the other one's in a 15 top duvet, right? So just like us, they like different temperatures, but is your dog at the right temperature? You know, if they're on their back, belly out, they might be feeling just very secure and comfortable, but they might be trying to get rid of some heat, right? They might be too hot. Or if they're curled up in a little ball, they might be saying that they're feeling a bit scared or nervous, but it might be that they're cold. So it's trying to look at what they're telling us and use that to inform where we put the bed, when we have access to that bed, and then of course making sure the bed itself is comfy.
And so what about the veterinary practice then? What are the things that are impacting the dog's sleep in a practice, and what can we do to change that?
So when I talk about our inpatients getting proper sleep, I often get, I think, appropriate pushback, right? Because we live in a world of necessary evil in a veterinary practice where sleep is concerned. And we know this from human hospitals, right? Nobody ever comes out of a 3-night stay in hospital refreshed from the fantastic sleep that they had while they were there, because you have to have clinical checks, you have to take your medicine. There are other people in that environment with you. It's not your home area. It doesn't feel right, it doesn't sound right, it doesn't smell right. So all of those things impact sleep quality in our pets as well. But the question that I always try and pose to people is, okay, so we know that they're not going to get all the sleep that they need, but what can we do? I think there are some small changes we can make that can be really valuable. So things like, okay, a lot of places, even if they've got staff in overnight, will dim the lights overnight. Is there a period in the afternoon where a lot of the staff are on a lunch break, or is the consults are running? Can you dim the lights in the back? Do we need the full lights on, or could you have lights down one end if people are going to do some blood samples or whatever, but keep it dimmer in the wards? Is that a possibility? Things like, especially if you've got ward staff, do you need the drip pumps to go off at full volume, or can you wrap them in a towel? Will this, you know, if people are in that room in an ICU, they're going to hear the drip pump going off, even if it's wrapped in a towel, because then there's not much else going on. So actually that's a lot easier to sleep through or rest through for the other inpatients if it's just muffled slightly. Bedding is super important. You know, we're really into my heartland talking about bedding. I'm trying really hard not to just talk about beds for an hour, because I could, and it would be very interesting for me, but probably boring for everybody else. But what kind of surface they're sleeping on is incredibly important, especially when you're talking about nursing recumbent patients. If they're too firm, they'll get pressure sores. If the water's tipping over there all the time and they're getting wet, then we can get really nasty pyodermas and things like that. It's a nightmare to nurse if you've got dogs on an incorrect surface. And then when they're starting to recover, of course, you don't want them on something too soft. You want them something that they can walk on and still feel comfortable. Talking about differences between humans and our veterinary patients, of course, we don't walk on our mattresses, do we? So a different consideration for us than for our pets.
Yeah, absolutely. And that, reminds me of my time in practice where we had exactly that. You know, the patient comes round and they're paddling around on a bed that is just unstable, and they've just had some major surgery. And so, yeah, it was a toss-up between a hard surface, the floor and some vet bed, or a mattress that they could actually get some sleep on. So that's some really good kind of practical tips there that our vets could utilise in practice. So how can our vets or our pet owners measure sleep? Is there a way that we can assess this?
So it's really interesting. So when we are sleeping, we go through sleep cycles, and you probably heard that term the same as in people, and there's 4 different stages. The first is N1, which is just going from being conscious to being unconscious. The second is N2, which is that light sleep. You're just kind of, the blood's coming away from your brain. You're settling into a sleep state. N3 is deep sleep, which is restorative for body, and N4 is dream sleep, REM sleep, which is restorative for brain. And I could talk for a whole hour about the intricacies of all of that, but that's all we need for now. And the reason that I talk about that is because the N1 stage of that, going from being conscious to being unconscious, while very quick for us, is a bit of an anomaly in our dogs. So they are in what we think is sort of an N1 state for about a fifth of their life. It's that, when they're sort of sat down chilling and they're kind of with you, and they're eyes are closed, but they'll peek if you go to the kitchen. So that they're not asleep, but they're pretty close. Right? So there's some debate in the scientific community as if that is truly N1 sleep or just relaxing. But it makes it really difficult to measure sleep quality, because if you use like a tracker, so a tracker that goes around, all that measures is that dog active or is that dog not active? So for a fifth of their life, they are not active at all, but they're not actually asleep. And it's the same if you've got video footage. It's the same if you've got owner reported metrics. So unless you start sticking probes in their head, it's actually almost impossible to know exactly what's going on. And of course, we don't want to do that for all sorts of ethical reasons. And they're not really going to get their normal night's sleep with a load of probes on their head anyway. So what we think the best method actually is owner reported metrics for our dogs at home. Obviously, they're not watching them overnight, but most owners have an idea if the dog has been up pacing, or perhaps they can use a bit of a tracking collar at least to know, did the dog get up or down. They have something amazing they call it the snore score, which I just think is adorable. It's an open access sleep score that you go through with owners, and it doesn't say yes they have bad sleep or good sleep. It just gives you a number that represents their sleep quality, and if the owners are concerned about their sleep, you can put in some changes in the bedding, changes in where the bed is, add in some extra pain relief, whatever it is that you want to try, and then in a couple of weeks you do the snore score again and you can see if there's been any changes. So it just helps you monitor rather than measure, I think.
Yeah. Okay. Oh, brilliant. I think we'll try and put the link to that paper in the notes for this episode, and then our vets can access it when they want to. Fantastic. So obviously you've got your mattresses available for kennels and for the home. Mm-hmm. Are there going to be, obviously all dogs are going to benefit from having a comfy night's sleep, but are there particular conditions that you might say, I really advise, in practice we have this kind of bed, or at home, for dogs with different conditions?
Yeah, absolutely. So, you touched on a really important point there, that you don't have to be poorly to want good sleep. It's a really fundamental part of health. I have a gel topped lovely mattress, and as of yet, touch wood, I don't have osteoarthritis or anything like that. But I'm not in purgatory sleeping on a wooden floor because I don't have those problems. So I would recommend that all inpatients ought to be treated in terms of getting good sleep. However, you're quite right, there are some cases where it's more important. So from a home perspective, we really talk about these beds being for dogs with joint disease or joint pain, so osteoarthritis, DJD of other types, anywhere where actually when you're lying down you're putting a lot of pressure over those joints and causing pain. Because what our beds are designed to do, and the reason that they have a stretch top, the reason that we pressure map them, the reason that the inner cover is so loose, the reason that we have the foam cut that we have, everything about these beds is designed that when dogs lie on them, it takes pressure off those joints and puts it onto less vulnerable tissues. Basically just takes the weight of the dog and spreads it over as much dog as humanly possible. And by doing that, we dramatically reduce the risk of pain breaking through sleep and waking the dog up. And we reduce the risk of hygromas, hair loss, just general aches and pains and stiffness in the morning. We know with osteoarthritis we can't take all of that away, but the more that we can take pressure off joints while they're sleeping, the better. So that's what we really talk about from a home perspective. Obviously, in a veterinary clinic, we have all sorts of emergencies where animals might be recumbent for a long period of time. And if you are lying still for a long period without moving, you are at risk of pressure sores. The NHS, for example, is one that they think they spend the most money on, is pressure sores in people in human hospitals. yeah, it's again, they can be really quite dreadful things. But when you're healthy, now I've been doing now, I'm sat on this chair and I'm wiggling around and I'm moving from sort of bum cheek to bum cheek without really thinking about it. And that's because somewhere very deep in the animal brain, I'm doing my own pressure care. If I've got a little bit of tissue that actually has been a bit starved of blood flow for a while because I've been squashing it with my body weight, I'll switch to another bit. And that's why in a normal mobile individual, human or animal, we don't need to worry about pressure care because they're doing that themselves. However, when we've got animals that are recumbent and can't move themselves, so if they're really poorly, anaesthetic recovery, we've got orthopedic cases, spinal cases, neuro cases, these sorts of things where quite often we've got animals that are down and struggling to mobilise for longer periods of time. We have to do their pressure care for them. And I think that's something we haven't really talked about much in clinical practice. A bit of vet bed on a metal cage floor is not going to provide that kind of pressure care. So actually what you want then is a really soft surface that they can sink into, which is what our vet rest duos, we have one of the sides is the recovery side. So it provides exactly that, a nice soft surface with pressure relief in, again, all pressure mapped. But then when they're up and about, which hopefully isn't too long, we flip the mattress over and on that side you've got a really firm walking surface, so it still provides some comfort. We don't need pressure care anymore because they're doing that themselves. Actually, they want a surface that they can get their legs underneath them, get up and get going.
Really innovative designs there with a lot of thought and love gone into that. I can hear the passion comes out in your voice as you talk about them. So yeah, I mean, I'm going to let you have a bit of a shameless plug now anyway. How could our vets in practice or our pet owners get hold of your mattresses?
So they can come to Nupsala, of course, our fabulous distributor. You can come on our website. So we've got www.vetrelieve.co.uk. So you can order through there. But if you're looking for something bespoke, there's also a contact form on there. So you can get in touch with me and you can talk to any of the Nupsala representatives. Will also help with any bespoke recommendations. And then we really try and do, I always try and position myself here. You can buy the off-the-shelf products and for some practices they fit perfectly, or for some homes they fit perfectly. That's great. Absolute winner. But every practice and every home is so different and every pet is so different. We quite often get asked for bespoke stuff. And we make everything in South Yorkshire. There's no China involvement here. Nothing's coming over in containers, right? We make everything is, all the sewing is on a sewing machine. All of the welding is done by hand with a welding bar. And that gives us a lot of flexibility. So we try and do is really engage with practices rather than just get some measurements in and fire back a quote. We try to say, why are you looking for mattresses in the first place? What don't you like about your setup, and how can we make sure that what we're providing you is going to fix as many of the problems as we possibly can? We can't answer everything. No, they're not indestructible. I would love, it's not possible to make something out of fabric that if you've got a humongous XL bully with a huge masseter muscles isn't going to be able to rip apart if they really, really want to. But we do try and make them out of fabrics that are as indestructible as possible. We weld them shut for help with infection control. We've done ones with corners cut out to drop bowls in, so we've not got bowls tipping all over the place. We've made U-shaped bolsters to go inside kennels to stop seizuring animals or neuro animals from banging against inside the kennels. We've made an operating table mattress with a bit that came off because they want to do some scanning. So they want a bit that was removable that could come in and out. So yeah, I would really say if you want to talk more about the Vet Relief product, please do check out the website and chat to the Nupsala team. But don't be afraid to say what you want if you can't see it.
Great. Oh, thank you for that. And hopefully you'll have lots of people going to your website to have a look at those. And again, they're on the Nupsala website if you're interested. So thank you so much for coming on today's podcast, Lauren. It has been really fascinating to hear about the importance of sleep and kind of the love and care that goes into the mattresses and why they're so important. I just want to summarise what we've heard today. So what 3 things would you like our listeners to take away from today's conversation?
I think the first thing would be just to consider sleep. A lot of owners don't think about it as being a veterinary issue. But a lot of people are worried about it. The dog's pacing or turning over in their sleep, or something has changed. But if the vet or the vet nurse who's doing their consult isn't asking them about it, it can be jarring to bring up something if you're not sure if it's the right forum. So the more that professionals can ask, or the more that owners can feel empowered to say, the more that conversation is going to go ahead, which is fantastic. My second one would be, you can do so much for sleep quality for literally no money. So go ahead and do it. We very rarely get to have wonderful conversations with our owners where there's no price attached, right? In this day, we've got medicines, we've got procedures, we've got so much fantastic stuff we can do, but all of that comes at cost. Whereas sleep, actually, a little bit of good advice, and they can make quite a fundamental difference to sleep quality at home without having to spend a penny. And thirdly, it's just, if you when you are thinking about kennel environment at home or in the practice, it's just to really think about what your dog needs. My soapbox is that every kennel should have a kennel mattress in it. Every dog should be sleeping on a supportive bed. And if I managed that, some of them would be mine, wouldn't they? That's great. I'm not, but hopefully it would just be the pets for whom that was most appropriate. So my soapbox is just try and do your research, see what's most appropriate for the animals in your care. And if you're not sure if we can help you, then pick up the phone or send us an email. And we're always pretty honest about that stuff.
Amazing. Well, thank you so much for all your time today. And I'm sure we'll be hearing from you again soon.
I hope so. It's been a real pleasure. Thank you, Megan.
Thank you.